Hello, and welcome back to the Handtevy How-To series. In this video, we will cover how to utilize the CPR Assist function in Handtevy. This is part 1 of 2, where we will discuss the features and how to integrate them into a working CPR. Part 2 will combine the CPR Assist in real time with a code that you can follow along with. As a reminder, access to the Handtevy system is only for active employees and volunteers of the Fairfax County Fire and Rescue Department. Let's start in the Handtevy app. All the features of CPR Assist work the same for both adults and pediatrics. For the sake of the example, we will use an adult patient. While en route to the call, open Handtevy and estimate a weight based on the patient's age for adults. In pediatric mode, choose the actual stated age that dispatch gives you. You can always change the age if you arrive on scene and find that it differs from what you were initially dispatched by clicking the main menu icon and selecting Change Patient Age. For this example, we will choose a 75-kilogram adult. When you arrive at the patient's side and have confirmed the patient is pulseless and apneic, click on the Start CPR button near the top right of the screen. It is crucial that you do not click Start CPR until you actually begin compressions, as this will disrupt all of your timing. When you press Start CPR, the CPR Assist window will appear, and you will immediately hear a metronome start. You will also see that the cardiac arrest protocols have been automatically activated, filtering out all non-ACLS medications. Remember, you can still access the full list of medications by selecting the Full List tab. When you are in an adult patient chart, the compression ratio will default to 30:2. You can switch to 15:2 if needed, but there should be no reason to do so with adults. As you perform compressions, the compression counter will count from 1 to 30, as shown here in the highlighted area. To the right of this, the cycle counter displays how many cycles of 30 compressions you have completed. On the right side of the screen, you'll see this timer, which counts up since your last rhythm check. Use this timer to track your 2-minute CPR cycles instead of any other timekeeping device. Next to it, in smaller print, is the timer showing how long you've been working on this CPR case. After 30 compressions, Handtevy will give an audio prompt to perform 2 ventilations, as heard here.
Ventilate. Ventilate.
Additionally, if you are using Handtevy on your phone, the flashlight will illuminate twice each time a ventilation is required.
Ventilate. Ventilate.
When the ZOL monitor is connected with defib pads and the AccuVent sensor, you can turn off the metronome and voice prompts for ventilations in the AV settings by clicking the speaker icon. Here, you can disable the audio-visual features as you prefer. While you can toggle the Enable All option, we strongly recommend against doing so, as there are some audio prompts you want to keep active. The best practice is to only disable the metronome and ventilate sounds and lights after the ZOL monitor is attached, and monitoring both compressions and ventilations. Keep these last 3 options enabled at all times. Note: when using infant defibrillation pads for a pediatric cardiac arrest, remember that the infant pads do not have a CPR sensor, so compressions will not trigger the ZOL metronome. Keep the Handtevy metronome activated during the entire code. Also, remember that the CPR sensor is designed to be removed from the chest pads to ensure proper placement on adults. Returning to the compression area, once an advanced airway such as an iGel or endotracheal tube is inserted, select Continuous, and the compression counter will disappear. Moving on to electrical therapy. After applying the defibrillation pads, stop compressions and analyze the rhythm. For the Handtevy team member, you can tap on the Electrical tab at the bottom to go to the defibrillation screen. But the easiest way while in CPR mode is to simply tap on the defibrillation button within the CPR Assist window. This opens a pop-up window for defibrillation with the First Dose automatically selected. Note: if you arrive at a scene where CPR is in progress and an AED has already been used before you arrive, you may proceed to select the next appropriate shock. Another important note about electrical therapy: if you select the defibrillation tool, you'll see a button that says Switch Device. If you're operating in a different jurisdiction that uses the LifePack monitor, pressing this will switch you from ZOL to LifePack settings. When you're on the electrical tab, as shown here, you'll notice the ZOL monitor is on top and the life pack is on the bottom. Make sure you record electrical therapy based on which monitor is being used. Okay, let's get back to it. You've started compressions, applied the pads, and analyzed the rhythm. If the patient is in a shockable rhythm, charge the monitor and deliver the shock, then tap Shock Delivered. If the patient is not in a shockable rhythm, tap No Shock Advised. Clicking on either of these will reset the cycle timer. Additionally, if you selected that a shock was delivered, the defibrillation button will turn green, and a number in parentheses will appear indicating how many defibrillations have been given so far. If you choose No Shock Advised, the cycle timer will still reset. However, it will not increase the defibrillation count. Note, performing this step during your rhythm checks is essential because each time you record Shock Delivered or No Shock Advised, it timestamps this in the report. This step is crucial for accurate documentation. If the cycle timer doesn't reset, verify that your AV settings do not have Reset CPR Cycle Timer after Shock No Shock toggled off. In the center of the CPR Assist window, you'll see the large Reset button. Pressing this will restart the CPR cycle timer, but it does not record a rhythm check timestamp. That's why it's crucial that each time you perform a rhythm check, you use the defibrillation tool to record whether a shock was delivered or no shock was advised. The only appropriate time to use the reset button is if the timer fails to reset when using the defibrillation tool. At 1 minute and 45 seconds, you'll hear this sound, and the cycle timer will turn orange. If you don't hear the sound, make sure that the Charge Monitor sound is enabled in the AV menu. When this sound is heard, it indicates the need to pre-charge the monitor. Tap the defibrillation button again to display this window. For the provider operating Handtevy, it's best practice to announce a countdown from 5 or 10 seconds to signal when to stop compressions.
Down from 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Switch compressors. Check rhythm.
Check rhythm. We have a.
At the 2-minute mark, you will hear a prompt to check the rhythm, as heard here.
Check rhythm.
The timer will turn red and continue counting up. Since we aim to be hands off the chest for 5 to 10 seconds, watch this timer closely. Pre-charging the monitor is crucial for minimizing hands-off time because if your patient is in a shockable rhythm, you can defibrillate. Select Shock Delivered, which will reset the cycle timer, record the defibrillation, and most importantly, timestamp the rhythm check in the report. One of the most challenging things for you and your team to relearn is not to stop compressions until Handtevy announces to check the rhythm. If you charge the monitor at the 1 minute and 45 second mark, when you hear the Handtevy audible tone, the monitor will charge to 200 joules much faster than 15 seconds. This will cause the ZOL to alarm with the charged tone while compressions are still in progress. For the compressor, keep providing chest compressions until the Handtevy system prompts you and the Handtevy team member announces, "Stop compressions." This will take practice.
You're 1 minute and 45 into the cycle. I'll be counting you down from 10 seconds to the next rhythm check.
Recharging to 200.
9, 8, 7, 6, 5, 4, 3, 2, 1.
Check
Switch
rhythm.
compressors.
Hands up. Looking at rhythm.
Okay.
We're in defib.
Defib.
Shocking. Everyone clear? Clear. And shocking.
Shock
Back on
delivered.
compressions.
Resume compressions.
Okay, moving on now. When establishing vascular access, whether IV or IO, tap on the Equipment tab at the bottom to see several procedures common in cardiac arrest cases. Scroll to the bottom of the list to see iGel, EZ-IO, and Lucas. Note that Lucas will not appear if you are in pediatric mode. To view the complete list of equipment, tap on Full List. Select either the IV and/or IO option, depending on the procedure being performed, and record the outcome. It is essential to document every attempt for any procedure, regardless of whether the result was successful or not, as this helps ensure accurate and complete documentation. Since there are multiple procedures in the equipment folder, it's a good idea to become familiar with the locations of the more common ones, such as BVM, ETT size, OPA, NPA, iGel, EZIO, and the Lucas device. A note about the Lucas device. Only document successful for the Lucas when you actually start mechanical compressions. If you encounter a problem getting it to fit on the patient or compress, document it as unsuccessful. The QA/QI team reviews every CPR call, and having accurate data is very helpful when reviewing the continuous ZOL files of your code. When it's time to administer epinephrine, you can either find epinephrine in the Medications tab or tap the Epinephrine button in the CPR Assist window. It will default to IV for the route of administration, but try to remember to switch to IO if that is how it is being given. If you forget, you can change this later in the code summary before submitting it to the Handtevy cloud. Once you select Given, the Epinephrine tab will turn green. Additionally, you will see a number in parentheses showing you how many epinephrine doses have been administered. Next to that is a timer showing how long it has been since the last epinephrine was administered. Note: to ensure accurate dosing and timing, it's crucial to record the administration of epinephrine as it is actually being administered to the patient. At the 3-minute mark, the epinephrine button will turn orange, signaling that you are now in the epi window. At 5 minutes, it will turn red, indicating that you have passed the 3 to 5 minute window. While in CPR Assist mode, you can still navigate through the Medications, Drips, Equipment, and Electrical tabs without the CPR tab closing on you. But you will have limited access to the rest of the app, as seen here when the main menu is clicked on. During the code, it is important that effective team dynamics and closed-loop communication be practiced. With closed-loop communication, when a team member performs a procedure or administers medication, it is important that the provider communicates clearly and concisely. The message should be distinct and calm, not rushed. This will allow the Handtevy team member to hear and record properly. The Handtevy team member should then repeat back what was said to ensure the message was understood correctly and confirm it to close the loop. This does not require more time, and in fact, is likely to save time and reduce errors. For example,
1 milligram of epinephrine administered IO.
Copy. 1 milligram epinephrine administered IO.
Another example is,
what is the next dose of amiodarone?
The next dose of amiodarone is 3 milliliters.
Copy, preparing 3 milliliters of amiodarone. 3 milliliters of amiodarone administered.
Copy, 3 milliliters of amiodarone administered.
moving on now. The next thing to cover is when you achieve ROASC. Remember that after any defibrillation, immediately resume compressions for 2 minutes before checking for a pulse.
Okay?
We're in VFib.
VFib.
Shocking. Everyone clear?
Clear.
Shocking.
Shots
Back on
delivered.
compressions.
Resume compressions.
This also includes if you see a rapid spike in end-tidal carbon dioxide, indicating possible ROSC. Regardless of whether you think you have ROSC or not, when you are prompted to pre-charge the monitor at 1 minute and 45 seconds, tap the defibrillation button and pre-charge the monitor to the next appropriate joule setting. Count down to the rhythm check, and when prompted to check rhythm, pause compressions.
Check rhythm.
If you see an organized rhythm, verify it with a mechanical pulse check. If you find that you have achieved ROSC, click the No Shock Advised button, then tap Stop CPR. This will open the patient outcome window. Select the appropriate option, such as ROSC in the field, and click OK. This will timestamp ROSC in your chart. You can continue documenting medications and procedures after you have closed the CPR Assist feature, and you should leave the chart open until you transfer care in the hospital. If your patient goes back into cardiac arrest at any time, click the Start CPR button, and the CPR Assist feature will reopen with the previously documented medications and procedures, such as the number of defibrillations delivered, epinephrine administered, and compression ratio. Continue documenting the CPR as before until another endpoint is reached, such as ongoing resuscitation in ED, or whatever is applicable. A note about the device using Handtevy to record the code. Whichever device the chart is started on needs to stay with the patient until you reach the hospital. This means the first arriving unit's iPad will be taken by the transport unit. It is not recommended to start another CPR Assist chart on a different device after the code has begun. An EMS captain or ALS specialist arriving last on the scene should not document procedures already performed on their device, as that would affect timing accuracy. However, they can take over the role of the Handtevy recorder on the first arriving unit's device if needed. Think of it like a tourniquet. Once it's on the patient, it stays on. You wouldn't take off a tourniquet someone else put on just to put your own on. Right? Okay, moving on now. After transferring care to the emergency department or declaring patient death, click on the blue arrow in the top right corner to go to the summary page. Here, you can review all the medications and procedures logged during this event. You can tap on any of them to edit or delete. In previous training sessions, we advised you to delete all electrical device data before sending it to ImageTrend to avoid confusion with ZOL data. However, this issue has now been fixed, and there is no need to delete any data. After reviewing all the logged data, click on All listings below are complete and accurate for this patient. Then, click the Submit button. This will send the chart to the Handtevy cloud, and you can download it into your EPCR. Keep in mind that once you send the chart to the cloud, the data will be removed from the device. The only way to view it again is by downloading it into the EPCR or requesting the PDF copy by selecting the main menu, Chart Archive, tapping the desired chart, then choosing one or both of the email options. If you are sending a chart from a unit iPad, please send a text message or email to Garrett Shields to inform him where to forward the PDF. For those who prefer a linear timeline of events, including rhythm checks, this will be very helpful in completing your narrative, as this is how it will appear. Understand that it will take multiple practice sessions with your team to become proficient, especially for crews who have not used CPR Assist during cardiac arrests. It is crucial to familiarize yourself with all the features, layouts, buttons, medications, and equipment locations before you run a CPR. We recommend practicing with your crew at least once a tour. Additionally, practice using the Handtevy app on every call, even for cases that only require one medication or procedure, such as an IV. The more you practice with it, the more comfortable you will become. Remember, the Handtevy training team is available for in-station training sessions. You can view a complete list of certified Handtevy instructors by tapping the main menu icon, choosing Contacts, and then expanding the Handtevy instructors list at the bottom. If you have any issues with downloading data into ImageTrend, please email the ImageTrend team, whose information is also listed in the Contacts section of Handtevy. As always, if you run into any issues or have questions with Handtevy, please send an email to fire.handtevy@fairfaxcounty.gov. Stay tuned for part 2 of this training video, which will be an interactive training session for CPR Assist that you can practice with. You can also view the other Handtevy training videos in the Handtevy app under Training Resources or by navigating to our YouTube page at youtube.com/@FCFRD Handtevy Training.